So today I want to talk about domestic violence, and if you or someone you know or love is in a situation in which they're being abused, then please tune in today because I want to talk about some factors that can contribute to keeping victims stuck in their relationship with the abuser. So one thing that happens is during an abusive relationship is that a chemical known as oxytocin is released in your brain, and oxytocin is responsible for bonding. So it's released during sex, it's released between an infant and a mother during nursing. It is a hormone that's released in your brain that creates bonding. That's what its purpose is. Now, oxytocin is released when there is a push pull between the victim and the perpetrator, meaning that the perpetrator switches between I love you and I hate you, come here, go away. They flip back and forth, and that push pull creates an environment in which the person is not only becoming chemically attached and dependent on this person and bonding with them, also known as Stockholm Syndrome, but the person is losing more and more of who they are. The abuser is just chipping away at who they are. And they are getting smaller and smaller, and their world is getting smaller and smaller. And it's really difficult to break away when the abuser has isolated you from family and friends and other resources, maybe has gotten you to stop working, maybe has gotten you to stop going to school, things like that. Abusers usually do that to victims for the purposes of keeping them trapped. But there are resources out here. Look into local resources, organizations set up to help victims get back on their feet, whether it's shelters or other organizations like Helpmate that will help you get set up with food, clothing, shelter, jobs, mental health, physical health, dental care, all that. So reach out for help. It's not too late.